Hi, I'm Lance, and this is UNSILENT, a speak series by No Stigmas that champions mental health advocacy and challenges the stigmas that all too often prevent people from getting the help they need. We're so glad you're here. Let's dive in.
I think a lot of people they have gone through their life and they then experience some type of mental health thing and they kind of get into the work and do advocacy and I think which is beautiful, but I would argue that every single one of us has mental health. And if I had to pinpoint a specific time that got me interested or involved, it's really difficult to do. I think that growing up to immigrant parents, there was a lot of mental health things there, adjusting to your community and society. And I went and lived in India with my grandparents in a really small village from 18 months to 4 years old. And, looking back on that and gaining insight into that experience and how it frames my attachments or approaches to relationships is really important too. And so I think the journey of mental health has always been there. But to really answer your question, I started in the beginning of high school, working in a research lab at Harvard Medical School in the neuroscience department. And then prior to that, I started taking a lot of classes in neuroscience and in basically sixth grade, seventh grade, eighth grade. There was this really cool like educational studies program at MIT on the weekends that was taught by current students there and professors, and they taught all these like really cool classes about neuroscience and the brain and science and also like how to DJ and turntable. So I did a bunch of random stuff like that. But I got really interested in it because it's just like it's so mysterious. And it's not just the brain, it's the endogenous and the exogenous consciousness that we have. And so I really wanted to connect with people, and I felt like mental health was the way to do that because we all have it. It's a shared experience. And so that really led me on my journey. And yeah, from there, I mean, things just kind of kept going and it continues to go, and I continue to learn every day. I will say that the anxiety is really what kind of drove me for a very long time. And specifically when I was in college, it really got to me. And that's when I started to discover meditation and yoga a lot more and get really deep into that practice. And that started to help me. And then continuing along that journey, the process of preparing and getting into medical school was super anxiety provoking, and then being in medical school was anxiety provoking and sort of an existential crisis of what am I doing. So I think that that was sort of the underlying premise of most of it. And and then I also experienced seeing how mental health affected certain family members, specifically in India, where it's a whole different landscape of stigma and a lack of resources and so forth at the time. So yeah, it is challenging. And, and to add on to that, like many can probably relate, just seeing friends and community members that I had been exposed to struggling with mental health and addiction as well, which is under that umbrella. So I don't want to minimize that too. So I started doing research, very molecular neuroscience based, trying to understand, learning and memory pathways at Harvard and then Columbia. And then I came back to Harvard and I was looking at stem cells and RNAi in pediatric brain tumors. So I was on this clear cut path to be like this, ideal South Asian pre-med doctor, whatever. And then I went to Wesleyan University in Connecticut, which is like a pretty liberal school, for those that might know. And I continued to study neuroscience, but I also started to study philosophy and ethics and really kind of widened my landscape. And it really expanded my ideas of consciousness and how we see the human experience. And I got obsessed with this idea of storytelling and trying to be a part of someone's story and understand it. So I was continuing to do, lab research at the time, primarily on addiction and depression pathways then. And it was great, cool, whatever. I'm doing it. I'm like hanging out with mice or whatever, it was a strange experience, but also grateful for it. But there was just something in me like, what is this for? And like, what is it to really be human and have that experience? I left the lab and I actually went to volunteer for another organization in India during my second year of college, and I went to Bihar, India, in the Northeast, and yeah, it exposed me to just mental health as being the core of everything, of everything. I mean, the UN has these sustainable development goals, which is great, but at the core of every single one of those is mental health. And if you can alleviate or assist in that suffering and um, have people gain insight into that suffering, you can really alleviate a lot of other issues like war, right? Poverty, community development issues. So that's what it came from. And at the same time, there was a family member who was going through the mental health struggle in India as well. So being exposed to that stigma. After that, I graduated, moved to Los Angeles to get out of the Northeast, pursued a psychiatry residency at LA County General Hospital in University of Southern California. And that was the definition of global health. That hospital was the definition of global health. Seeing over hundreds of languages, immigrants from all countries, it was it was a lot. It was a lot to see. And LA is a big county. There's a lot of substance use and homelessness and severe mental illness. And yeah, I'm very grateful for that experience. Um, I trained during COVID as well, which is a whole another ballpark that challenged my mental health to a degree that I never thought would. Including just actually experiencing, suicidal thoughts, right? For a period of time. And it it that experience got me connected at a deeper level to my patients, though, and to experience a sliver of what they might be experiencing on a daily basis is pretty special. So I take that as a strength now, to have gone through that experience and that emotional state. Putting out a quick fact sheet of or resources to, like, a meditation app, whatever. It's cool, but the problem is the way that healthcare is done, the training, right? It's rigorous training, and I understand the need for some of it, right? I am originally East Coast trained, so I get it. I get the battleground, the war zone of going through residency and all that. But there's a better way to do it. There's a way to do it, but also create an environment where people are not afraid to speak up or to say, like, I need an hour, I need a day. Like, I just like need to reset here and I need some help. That there's fear, though, to speak up. And I would argue, like, the stigma is almost worse within the healthcare field. And physician suicide is terrible. It's much worse than the general population, right? And we saw dramatically during COVID physicians losing their life to suicide. And specifically, a huge story out of New York City, right? There was an ER physician who was top of her game, who lost her life to suicide. Um, and so the only question I have is, like, when do we stop looking at headlines and holding our heart for a few days versus when do we start actually making change happen in this and change the way that we think about it and the way that we address and care for each other, especially in this field? Because when I was training during COVID, it was tough, man. I mean, I was a psychiatrist, but I also did have the opportunity in some ways to help cover general medicine and the COVID units for a bit of time, just because I saw my peers in that space being burnt out and finding them in stairwells crying and just being pushed to the grind, because it wasn't just taking care of patients. We were also getting infiltrated on through media and social media, right? About um, oh, is it really real, right? Like, is COVID really that bad? There's a lot of different opinions, and I get it, because when there's uncertainty, it leads to anxiety, which leads to fear. And I understand all of that. But as a physician who's in the unit and you're seeing people dying on you, and you're burnt out, what are you going to say? It's just compounding onto it, right? And it's a whole other issue right now. There's a positive to people talking about healthcare and health and mental health, but it's also really impacting a lot of mental health professionals and physicians who are having to have these conversations and re-educating and being faced with a lot of resistance and anti-medicine vibes. And for me, I want to integrate both sides of it, right? I'm open to the conversation. So during COVID, it was just that escalated level. And for me, I was pretty isolated personally. I mean, I fortunately had a good community of friends to talk to, but I didn't want to see them initially because there was no vaccine. There was a lot of uncertainty of what could happen, and I was working in a hospital, and there was a few times, when I was working nights straight in an inpatient psych unit, and during the day I couldn't see anyone, so I was literally just hanging out with people who had very severe mental illness, and then trying to like be at peace with myself during the day. Um, and it was really challenging, and it eventually got to me. Just like July 3rd, 2020, I was just like paralyzed in my bed, like pretty negative thoughts of like desire to just end it all, and I think that was tough. That was tough. And I got through it. And I got through it because I fortunately built a structure of people around me that, we would check in and reach out to each other. So, um, yeah, I think it needs to change. It's not just in the homeless community or, business community, whatever it is, every single community, because it's everyone again. It deals with mental health, and in healthcare the conversation needs to be transparent and open, because we're not caring for those folks, and we know that will trickle down to impact the patients they see. I'll say the positive to this is there are steps being made and changes being made. There's chief wellness officers that hospitals and institutions are hiring. There are therapists on staff, confidential stuff. There's, I've been able to start physician burnout programs when I was in medical school and residency and speak openly about it. There are physicians, younger ones typically speaking out, some older ones coming and speaking out as well. And so it's definitely shifting. The landscape is shifting, and I think that we will see it change more and more generationally, because it's the younger people who are really trying to change it and shift it. And so I am excited for that. But I do think that uh, we have to work a little bit harder from all prongs to really create an environment that's open, for people to speak up. Because even me, speaking out about it, there's still like a hesitation, right? I mean, there was like, oh, what if a patient sees this and they see like their psychiatrist had struggled on their own? Is that positive or negative? And or if my boss or someone I work with sees it, right? And so I had to get over that barrier personally. I know a lot of people did as well, and I know people who struggle who don't want to talk openly about it, right? And I respect that too. So yeah, things are changing in a positive direction for sure, but I do think that we need all levels, including government, management and hospitals. And perhaps, we actually do more training for people in leadership about mindfulness and emotional resilience and creating these structures, and how do you actually create that environment. And comes back to education, right? The first thing I'd say is don't overthink it. You don't have to have a huge platform or create this wild thing. I mean, the biggest impact you can have, again, is simplification, which is actually just reach out to someone. Let's get off the digital and just reach out to someone, make a call, go on a walk. Um, that's it. That's it. Because the trickle effect of impacting someone's life is pretty amazing, and it doesn't even have to be someone you know. If you go get a coffee at a coffee shop, just go and have a little conversation with the barista, right? It's just the micro. We didn't talk about this when we're running out of time, but it's the micro connections that you have with the barista, the person at the bookstore, a smile at someone on the bus or the train or the subway. Those were lost during COVID. And we recognize now that micro connections build up to help ground you and to build emotional resilience. And it's the spurts of joy of dopamine that keep you balanced. We lost that during COVID. And so those are powerful. And so if you want to be an advocate, it's about just bring those back into your life and into the other person's life. And a facial gesture or a hi, hello, how are you, can really make a huge mark. And just imagine if everyone did that. The key here is that, self-harm and self-loathing and unfortunately suicide occurs when there's a loss of hope. And a loss of hope comes from when you feel no longer connected to anyone or anything. And so if you were in that state, imagine if you were in that state and then some random person on the bus just said, hey, how you doing? it just sparked that. You just prevented someone from losing their life to suicide, right? I mean, I'm simplifying it for this, but you can have that. You can have that impact, and that's what being an advocate is.
To go beyond the show, be sure to connect with us on all social media platforms at No Stigmas, and you can always reach out at nostigmas.org to connect with us and see how we can team up together to champion mental health equity for all. Remember, to break these stigmas, we must be unsilent. We'll see you next time.